Can we have the first slide, please, and turn the lights down low. Let's use some tennis strokes to analyze chest films. It's said that 70% of pathology in a chest film is readily seen, 30% is not. You have to develop some scanning strategy for that, and to do that, let's look at the fundamental stroke Don Budge had for his backhand: start low and finish high. A way to develop the knack for that is to put a grapefruit under your armpit and let it drop when you finish high. That's fine, helps your stroke, but makes grapefruit juice on the court. Now, here is a patient who came in whose grapefruit wouldn't drop. If you start low and finish high, that right lung looks normal. Remember, though, that you have to, for a good serve, finish on the other side. Be sure and finish the other side, starting low and finishing high, and there's this patient's tumor nodule. To start low, look in the costophrenic angles for pleural fluid. The hemidiaphragm, is it up or down? Is the diaphragm paralyzed? Is there emphysema? Is it a normal diaphragm? Is there fluid in a subpulmonic position? Are there curly V lines? Is there free air? Here's a picture of curly V lines, which show us that this patient is in congestive failure. A good place to start low is in the costophrenic region. When you wind up high, look for pneumothorax, tuberculosis, or Pancoast tumors. Remember to volley the apices, because in this patient, if you don't look hard and go back and forth, you'll miss the tumor or tuberculosis, as the case may be. This sounds poetical. It doesn't mean I'm not here at the lordotic film. A lordotic film in that patient shows the patient's lesion. Billie Jean King keeps her eye on the ball, particularly the seams on the ball. When you look at the lungs, focus on the vessels as you scan. There's more than just vascularity there. There's miliary tuberculosis. Here are millet seeds for comparison, and this patient died of raging consumption, miliary TB. Remember, too, to cross over, not only for volleys, but to compare the hilar regions, particularly for tumors, lymph nodes, as well as the position of the hilum. It may be moved in atelectasis. Here is a patient. If you look carefully, you can see an increased density in that region compared to the other side, and this patient had an infiltrating tumor in the intermediate bronchus. Finally, if you want to volley well, look through the strings. If you want to see the chest completely, look through the heartstrings for pneumonia, atelectasis, hiatal hernia, and paraspinous mass. Here's a child who's febrile, and it's hard to see, but look through the heart. There's a different density between the apex of the heart and here, and a darker film shows the pneumonia that the child has. So finally, remember to start low, finish high, focus on the vessels, cross over and back, and look through the heart, and chest films, any one.